Hello, I'm Dr. Rayful. I'm a Central Illinois chiropractor at Eastside Wellness Chiropractic, and today we are going to talk about part 3 of the all-important anteromedial hip. I find this guy is a real culprit with so many people because he gets affected with sitting. And this is really related to tearing of discs and also, I find, TL junction pain. So there's 2 parts that come before this. I would do those first because this exercise is going to be much more aggressively getting into your back. And if you have a hot back, you definitely don't want to start with this one. Okay, so I'm going to do the anteromedial hip for the right side. I'm going to bring that foot straight ahead. So it's pointing, I'm going to say at 12 o'clock, and this foot is going to step out at 7 o'clock. This knee is bent, this knee is straight. Okay? And I'm going to first, from this position, drive single hand forward and back. And I can use my head as a driver too, and I'll even get deeper into that anteromedial hip. Remember, keep that left knee bent or you won't get the work that we need. Okay, then we can do 2 at the same time. Great. Then I'm going to start off with an easy rotation, and I'm going to keep my shoulders and hips over each other. And I really am only thinking about twisting my hips here, and my shoulders are just going for a ride. Now, right now, I'm not continuing to twist with my upper body, keep them over each other. Then next, I'm going to do frontal plane or side to side, and I'm going to go to the side, to the right. I'm tipping, but I'm tipping forward. That's not quite as aggressive. Then I'm going to tip straight sideways right over the middle of my head. And with this hand, as I'm doing that, I'm pushing down and in. And then I'm going to take and bring my hand into extension with tipping to the right as I drive with the right hand. And you will feel that very deep in the front medial hip. Okay? Then I'm ready for hybrid hands. Now I'm going to do hands going in separate directions to get as deep as I can into that anteromedial hip. So again, left knee's bent, right knee is straight. I'm going to draw an arch backward, tip to the right as I punch high to the left, just like that. Now, once I do that, I want to stabilize that. I want to learn how to control it. So when I go to stability, from a bent left knee, I'm going to go to a bent right knee and barely toe touch with my left foot. And I'm going to do the exact same motion, but try to do it on a single leg or as close to that as you can to control that motion. I need to be able to control. Then I find with some stubborn ones, to finally get that anteromedial hip to start to let go a little bit, we need to get plyometric. So when I do that, I'm going to build up the outside of my right foot. So the 5th ray, the outside of my foot is lifted up, so more weight is on my big toe. Then what I want to do is flex from my hips, rotate inward as much as I can, and hip check to the right. I cannot stretch my glute too much more than that. And then from here, I want to explosively jump, not straight to the side, but behind me this way as far as I can go. Again, here, flex, twisting to the right, hip checks, and now explode as far as you can go. Thank you.